everyone, and welcome to today's ESG-CV Report Training Webinar Part 2. My name is Natalie, and I'm just going to spend a couple brief moments going over logistics before turning it over to the team. I want to make sure that it's very clear from the start, though, that today's webinar is for recipients. So if you are not an ESG recipient, you are welcome to stay on, but please know that the content is not intended for you, that it's, again, ESG recipients, which today we'll be focusing on city and local recipients, and tomorrow will be states, but those are the primary audiences that we're focused on today and tomorrow. In terms of audio, if at any point during the webinar you are having audio difficulties, we encourage you to call in on the numbers that are on the screen. We'll go ahead and put those in the chat in just a few moments. But again, we often find that the computer audio can sometimes be a little tough, so that's why we put the toll-free numbers up on the screen in case you need to use those during the webinar. Also want to mention, in terms of connecting with us during the webinar today, everyone that is a participant or an attendee, you're all going to be muted for the duration of the webinar, but we do have a chat functionality within WebEx that we really want to make sure that you are using during the webinar. That chat functionality is where you should send questions, comments, feedback, reactions, things that you want to share. Again, send those all into the chat functionality. To find that on your screen, just look in the center of your WebEx screen. You should see a row of several different icons. One of them will look just like a chat message bubble. And if you click on that, it will open up the chat messages for you. You see a little red dot, that means that there's a chat message for you to read. And when you are submitting those, again, questions, comments, messages via the chat functionality, please take a moment to make sure that you are sending them to everyone. So the two bar, which should be right above the chat message box, should default to everyone. If it does not, then just take a moment to look at the arrow over to the right-hand side. Go ahead and scroll down, and you should be able to find everyone towards the bottom. This webinar is being recorded. A copy of the recording, along with the slide deck, will be posted to the HUD Exchange. Just please make sure to give us 2 to 3 business days, and we will get that posted. I believe now that I have just going to turn things over to Marlisa Grogan at HUD's Office of Special Needs Assistance Programs to run us through the list of presenters and get the webinar content started today. Marlisa?
Thanks, Natalie, and welcome back to everybody. We appreciate you taking the time to join us to dig a little bit deeper into our ESG quarterly reporting requirements for CARES Act funds. My name is Marlisa Grogan. I'm the ESG team lead in HUD's Office of Special Needs Assistance Programs, and I'm also joined by Michelle Budzik from the Partnership Center, as well as other teammates from APT Associates, as well as other PCL staff and experts in SAGE and HMIS who are going to be here for support as resource advisor. Next slide, please. What we're trying to accomplish today is to provide recipients, you are local government recipients of ESG-CV funds, with an understanding of how to use SAGE for ESG-CV reporting, which will include using the ESG dashboard in SAGE, launching a report for completion, reviewing all the forms and fields that are required as part of your submission, and we're going to pay special attention to HMIS and victim service provider contacts, the bundling process, as well as the financial part of the reporting requirements. And just as a recap, part 1 of the series, if you haven't already tuned in, that provides an outline of the basic reporting requirements, a review of the components and activities for ESG funding, and also a general the general reporting requirements and access instructions for how to get into the system. Next slide, please. To set a little bit of context before we get started into the reporting details, we just want to reiterate that this is just an unprecedented amount of funding that ESG has never really seen before, and with that in mind, it's so important that we have an understanding of the impact of this funding and to be able to be held accountable for it and to report back, foster transparency with our communities and Congress to show them how this funding is being used, and really to tell the great story of everything that you all are doing with it in your communities. And our priority, as also stated by our federal partners, is to minimize extra reporting burdens. So we want to ask the least amount of you and to be able to still get a strong idea of what you're doing and foster transparency. So the additional requirements we want to be aware of up front are that this is going to be required on a quarterly basis, and that HMIS leads will have an increased reporting function to be able to reduce duplication. Next slide, please. I want to reiterate what Natalie already pointed out, that this webinar is focused solely on our ESG recipients. So the cities, the metro cities and urban counties who are directly receiving the ESG-CV grant. Cities and counties are being covered today, and then states will be covered on the 3rd. So just keep that in mind when you listen in, when you tune in. If you're not a recipient, our perspective is really towards recipients, so we're delivering the content with them in mind, with you all in mind, and then also the questions that we answer through our Q&A are also being sensitive to the recipients. So we're strongly keeping them in mind when we're answering questions and delivering content. Just to clarify and differentiate between the different terms that we all use interchangeably sometimes, subrecipients we are considering and defining here as the entity who receives funding from the recipient. So that is, it's generally a nonprofit, a private nonprofit, but it could also be a pass-through entity. So there could be a case where a city or a county subs to a larger nonprofit, and then the nonprofit does a second-tier sub-award to a sub-subrecipient who receives funds from the subrecipient and does the direct services and the direct provision of housing for our program participants. So just to run through a really quick example, let's say you have a county, an urban county that receives the award directly. They could sub to a city as a subrecipient, a member city that does not receive direct ESG funds, and then they could sub to a private nonprofit. And again, we're focusing this presentation on recipients. Next slide, please. Every entity that we're going to mention today has its own role related to data reporting and submission. So the yellow arrows are flagged for you, our recipients, to pay particular attention. Those are going to be your roles. So starting at the top, recipients contract funding to their providers who enter data into SAGE for SAGE reporting. And direct service providers, which we just went over as the subrecipients or the sub-subrecipients, they're the ones who are entering the data directly into HMIS or a comparable database. And then HMIS lead staff or victim service providers, they are responsible for generating the CSV report from the HMIS or comparable database and uploading them into SAGE. So that's a little different from traditional ESG CAPER reporting, but this is now the role for HMIS lead staff. And then once the CSV reports are uploaded into SAGE, then you, the recipient, will then receive the CSV reports, review the information, and then it's your responsibility to submit the ESG-CV report to HUD. And now I'm going to turn it over to Michelle to dig in deeper into HMIS reporting in SAGE.
Thanks, Marlisa. We just want to also go over the word implementation. Again, the 3 slides, the 2 that Marlisa just did, and this one address many of the questions that we got last week from participants that were on the call in Part 1. An HMIS implementation is an area where a geographic area that is covered by the software and where the data is entered into a single server. In general, there is an HMIS lead agency associated with every implementation. So the first kind of implementation we have is the normal one, where a COC has their own implementation. They have the HMIS lead agency. They control the software and all of the project data in one server, and that's the norm. The next kind of implementation that's less popular is a multi-COC or regional implementation, where 2 or more COCs have agreed to share both the software system, the policies, staff, servers, all of that. Again, think multiple COC or regional implementation means it's all going into one place. And then at that place, there should be an HMIS lead. We know that in these kinds of implementations and in statewide implementations, oftentimes COCs identify somebody in their continuum also as the lead. For this purpose, we're going to ask you to remember that only one person from the regional or multi-COC implementation has to do the reporting. Every COC does not have to do the reporting because it's all coming out of the same system. So we're going to ask you to get together, talk about it, decide who should do it. Same thing for statewide implementations. Places, Michigan is a good example. It's been a statewide implementation forever. I know that multiple places in Michigan think or have staff, local HMIS staff to support their providers in that local COC, but somebody is in charge of the statewide implementation, and that somebody it should be the one that we're identifying as the person to pull the report. If you don't know who that is, you guys need to work together to identify that person. For recipients to get ready for report, we're asking you again to make sure everybody has at least one active user in Sage, and that at least one person in every community at every recipient is a data entry and account admin user. That user can approve other users and will also be required to submit the CAPER to HUD. We then want you to be able to reach out to and contact the HMIS implementation in your geography so you figure out who the contact person is. There's no reason to wait on that. You can do that right now and start figuring out who's who and who's going to be your contact person for each HMIS. If you're funding a victim service provider, you want to reach out to the victim service provider and make sure they are using a comparable database that can run a CSV CAPER. There's a test functionality on the login page of Sage. In case you need to test a report, they could run a report for a current program for a short date range, try to upload it, and see if it takes. So those should be tested and run right now. The next is sometime next week we'll be live, and you will be able to log into Sage and enter all your HMIS and victim service provider contacts. You can even start entering your projects. You can do whatever you need to do so that by October 1st or so, you're able to actually send to the HMIS lead or victim service provider contacts the list of projects that you want the CSV reports from them at. I'm going to take some time and show you SAGE now. So if you are, we're going to go to several different recipient entities during the course of this presentation, just so I can show you the different steps, because we stopped and started reports in different processes, at different stages of the process, so that you would be able to see them. If we go to SAGE, there are two sections of the dashboard. This section, an ESG recipient would be very familiar with. This is the way your report currently looks right now. This is our test system, so the data might not be totally up to date. And this is the way the system will look when ESG arrives. The ESG-CV program will be up here. And you will be able to go to the Launchpad directly, and you will see this page. When SAGE goes live, the guidance information will be all in this bar. It'll also be posted on the HUD Exchange, but you can easily get to it from this bar so that you can have it at your fingertips at any time. And under resources, it will also be here in guidebooks. There's also quick tips and help information about adding and deleting users that you might find helpful. So the first thing that you'll do when you log on is go through the process of creating the report requirements. So we're going to ask you a series of questions. Your answer to these questions determines what projects are going to get, what forms are going to get turned on for you to complete. First, we're going to ask you if you have executed a grant agreement. If you say yes, it's going to move you to the next thing. If you say no, that is all you have to do. If you do not have an executed grant agreement by October 1st, you're going to click Save, and you're done for this first reporting period. But if you have an executed grant agreement, then we're going to ask you if you've made expenditures. Expenditures are different than draws, you know, so have you made expenditures of funds? If you say yes, we're going to now ask you what kind of expenditures you've made. Have you made just HMIS and admin expenditures? If that's all you've made, you're going to save the form. And the only thing that you're going to see is a financial information form that's available for you to complete. There's always going to be this contact form, which is more of a communication form than a required form. It's not, the contact form is your contacts, but the basic is the financial information that you'll have to complete. If you say that you did some unique activities that the CARES Act allows for, and you'll see here that there are 2 unique activities listed. There are some more to come in notice, and when the notice comes out, you'll see those names change to the names in the notice of the unique activities. If you press that, you're going to click Save, and it's going to also ask you to complete a unique activities form, and we're going to go through that form in just a minute. So you'll see you just do unique activities, financial form, and contact information. If you actually started serving clients in any of these kind of projects and you click even just one of these, you're going to do a full ESG-CV report, and all of the fields are in, and they're all required to be completed except for this additional comments one. They're all required to be completed in order to submit to HUD. So as we talked about last time on the call, on this form, you're going to set your report starting date. Again, this is the date where the preponderance of people in your projects from January 21st, when you're allowed to start spending money, till September 30th, when the preponderance of people have been served, and you're going to pick a date in that period. You're also going to tell your ESG your HMIS leads or your victim service providers what date you want the reports back to you to the CAPER. So you have 30 days to submit to HUD. Beginning October 1st, it's got to be submitted on September or October 30th. So when do you want those reports back from your victim service providers and HMIS leads? Probably a couple of weeks in. So it gives you time to review them, gives you time to deal with it if there's something wrong, or goose somebody that was late in a submission. You're going to go next and add your HMIS and comparable database system contacts. You're going to add a contact for every organization, every HMIS implementation, and for every victim service provider that you funded. Again, each victim service provider should have their own comparable database, so each one of them is going to have to be named here. But if you have an HMIS lead, you're going to put that information in. The 8-character ID is part of the name that the bundle will be called, so you know where it went and who it's going to. We recommend strongly that if your organization is, for example, one HMIS, that you're going to come down here and say H1, so that you know that this is one HMIS versus Twin Cities implementation. And then if you went down here, you'd name it maybe H-Twin, so that you can identify those apart. You're going to tell us if this is a victim service provider that's collecting the data or not, and you're going to put the contact name and information in for each person. When you've saved and added another, you'll be able to go and see all of them, and I'm going to change the entity and show you what that looks like. So in Arizona, we loaded all of the data as if it was, as if everything they funded for ESG was funded for ESG-CV, and so they have a full complement of a report here for you to be able to see. When I take a look at their HMIS and comparable database systems, I see that we have 3 different HMISs across Arizona, and they funded a safe shelter, a DV shelter. So you can see what's going on there. You can see who that is now because you've entered all of those on the contact information form. And when you save it, they go on this list. You can go in and edit this form at any time you want to edit it. For example, the contact person at the HMIS left and you want to put a different contact person in or a different phone number, or you didn't really like the name you gave to your for the ID, you want to change that. You can do all of that anytime you want to. You're going to return to the submission launchpad then, and you're going to enter your funded projects. When you enter a funded project, you're going to enter them by the project type. You're going to tell us the regular emergency shelter kind of projects that you funded. You're going to tell us what any temporary emergency shelters you funded, street outreach programs, rapid rehousing programs, and homeless prevention projects. If I go in here, you'll see that there's a long list of projects, and to add a project, I'm sorry, I have my bundles created. Let me uncreate them and show you. How to enter those projects. I'm sorry. So I want to go into my emergency shelter and pretend I forgot one. I'm going to go in and add a new project, and you will add the name of the subrecipient, the name of the sub-subrecipient, the project name. An optional tag is really optional. That's left for you as a recipient if you want to put in a note about that provider. Oftentimes we have found in regular ESG that people have wanted to put their contract numbers here, so you can do that should you choose. And then you're going to select a victim service provider. We took all of the information from all of the agencies that you ever funded and put them on a list for you, and you can pick from the drop-down list, so it's really easy. If you pick a provider that also had sub-recipients, you gave it to a city or community that had sub-recipients, then the sub-recipients that provider had in the past are going to be identified here. Should you give it money to them, but the subrecipient is somebody new, you can just type in the new name, and that's not a problem. If the subrecipient themselves is new, you can also type in a name, and that's not a problem. So it will allow you to do as many variations on this as you want. We just tried to put the organizations in so that as you're communicating with the agencies, the actual name of the organization being funded is what they're seeing. It's not some abbreviation for it. The project names, we are asking you to name the project by a name that the HMIS lead is going to understand. So if you name the project by the name of your contract number, they have no idea what project that is. If you name the project Primavera TES, they're not going to know that you want the Primavera emergency shelter rather than the Primavera temporary emergency shelter. You need to say specifically what you want here. And this is just an example of kind of how this has been coming in. Then you're going to select which victim service provider that services that area, and we gave it to you by names. Once you save it, it's going to flip over into the codes that you created. Once you've created all those, once you've put in projects in every one of those tabs, for every one of the projects you funded, each project gets an individual line, and the lines are by project. They are not by expenditures. So you would not have two lines for an emergency shelter, one for services and one for operations. You would just have one single row, one single project, a shelter project that you are asking funds for. You also do not change these because you renewed a contract. The ESG-CV funding reporting does not specifically aligned to your contracts. And so it's important that you don't think of this as contract by contract. We have some places where the contracts don't run continuous with the project funding or the operating year or the quarters or whatever. That's okay. Just put the project in one at a time. And the first submission, the report start date is going to be the same report start date that you selected in step 1. After that, after the first initial submission, where everybody's start date is the same, you're going to identify the start date for a project. And at that point then forward, that project will have its own unique start date and will be in a bundle with the projects that all have that same start date that are also that same component type. If the project has ended, if you've decided that you didn't want to fund the project anymore, you will be allowed to put an end date in, and that will remove it from the quarterly bundle, but we'll keep it in a cumulative bundle so that that project's cumulative data never goes away for you. Now, creating all these bundles with a start and stop date is nothing short of a nightmare, and we didn't want you to have to do it. So in this example, we have 44 projects that are put in, and that's a lot of projects. There's 17 projects that you've got to figure out what bundle they go to, and nobody has started late or ended early yet. So there's just a straight 17 emergency shelters that are all going to be reported on in the same thing. We're going to press create bundles, and Sage is literally going to, that fast, create the bundles for you. So it's now telling you what these bundles are, and it's put every one of these 44 projects into 12 bundles. And the bundles, you have one bundle going to Balance Estate, one bundle going to DB Safe, one emergency shelter bundle going to Marion, one to Prima. These numbers will change once there's a cumulative, a request for a quarterly bundle and a cumulative bundle. The first period, the initial reporting period, we only take one. You don't have to put in two. We're going to duplicate it for you because the same thing you put in for quarterly is the cumulative. After that, you're going to have a quarterly and a cumulative for each project. Every project's going to be in there. And so the bundles will change projects. We're going to ask you to view and approve that you got the stuff in the right spot, or that Sage got the stuff in the right spot, and it's doing that based on, again, you said this belonged to Balance Estate HMIS, so it put it in the emergency shelter for this date range for the Balance Estate HMIS. Here's all the projects you funded. Here's all the project names, and you take a look at it, and if it's correct, you approve the bundle, and you go on to the next bundle. And you'll go through all of those and approve them. Let me just tell you that once you've approved the bundles this first time and gone through all of this work, if the bundle doesn't change the next round, Sage is not going to ask you to approve the bundle the next time. It's going to automatically approve it for you. So we're trying to replicate the data as much as possible so that the projects will all be pre-populated, the bundles will all be ready for you, and to save you steps in work. But at this point, you're going to have to review each bundle and approve it. As you review and approve, once you're finished with that, please approve all bundles before sending. A send button will appear here, and you'll be able to send the bundles. When you send the request for the bundles, what's happening is that Sage is sending an email to the HMIS lead or victim service provider that you identified. So in this case, the Balance Estate is going to get a request to run these projects in one CSV upload and upload it to your report in the system. I need to change entities to show you how that looks when it comes in. So if I take a look here, you'll see that we've got reports coming in, and once they come in, it looks like this, and you'll be able to identify what's in and what's out because you'll be able to see what's there. If you take a look at just Q4 and 5, it's going to show you the names of all the projects that are in the report, and it's going to show you that the projects served. The validation table is kind of a summary table of all of the people that were served in the projects by different kind of cuts. It's this validation table that all the tables in the report have to validate to. So if we said there are 1,000 persons served here, we're going to look to make sure SAGE will not take the report if there's not an identification of 1,000 sexes and 1,000 ages, and it has everybody in a household with a family. You're going to, it's going to all have to balance, and the HMIS systems are used to having that balance. You can close it or print it or do whatever you need for that, but that's how it looks when it comes in. And again, this is a state submission, so it's really long. If you are a city or a county, you can expect to have this a very short list and nowhere near as complicated as it is for the states to do. I'm going to go back and pretend I had all of the data in, and I'm going to now look at completing my allowable activities. So the allowable activity form asks you very simply to identify what you provided during the period. Did you provide a temporary emergency shelter? Did you provide training or hazard pay? Whatever you've expended funds on, you've provided at this point. So you're going to say, perhaps, yes, you did a temporary shelter. It's going to give you a box that will allow you to answer this question. You need to describe the services and how these services were used to address COVID-19 and why you believed it was necessary to do this in your community. This is a short answer, though. It's only 2,500 characters. So we're not looking for dissertations here. 3 sentences might do it. You can do more if you want. You can enlarge it so that you can see everything. You can shrink it. You're going to say whatever items you said you provided in these kind of unique activity list, you're going to have to describe. So whatever you funded, you'll describe there. And I'm going to go back then to the dashboard because I filled all of those out. And I'm going to go to a financial information form. The financial information form in SAGE is all of the funds that you've actually expended in this quarter. So again, it won't necessarily match your draws from IDIS, but it should match all of the money that you actually expended during that quarter. And so you'll enter all of those expenditures. You will, the previous submissions, this is an initial report, so that's blank, but the previous submissions will add up and be here from the dollars you've reported previously, and then you'll be able to see your balance. And you enter each component, and the unique activities that apply to that component will also have to have a dollar figure entered for the activity as it was provided in that component. So if you opened a homelessness prevention project in the past several months, and to get anybody to work there, you had to pay hazard pay. You're allowed to do that according to the CARES Act, and we're only showing you the allowable activities that are listed in the CARES Act specifically. That will, of course, be a notice because they're in statute. There will be some others added later also. but you will list those here. Once you have done all of that, you are going to actually submit the form. So in order to submit, you have to have everything completed, and you go to the Launchpad. Sage shows you that everything's completed. All of your CSVs are in. If they're not all in, Sage will not let you submit. So you've got every form and everything completed. You'll go to the Submit button, and this is where our recipients often forget to do this. They get all the way through the whole report, and they don't submit. So we're asking you please to remember to submit. You put the submitter's name here, the title and position, any notes that you want the field office to see right on top of the form when they open it, you can put those in here. You save the form, and as soon as you save it, it's on HUD's desktop in Sage as a submitted report. I'm going to pause and see if there are questions that we need to do. Meredith,
yes.
Are you?
Yeah. Yeah, so I've been answering as many as I could, but there's a few that I want to make sure that we're real clear about. So I would like to talk about how to choose the start date. There's a couple questions about that. So specifically, what do you put as the start date if you started spending admin funds in May but didn't start funding rapid rehousing and prevention projects until August?
Your start date would be August. It's the date that you started to serve the preponderance of clients. Admin doesn't serve clients. HMIS doesn't serve clients. If you only expended funds on training, for example, that didn't serve clients. It served the entities that serve the clients, right? So it's the date that you really started serving clients. So in your example, that would be an August start date then, August 1st.
Great. There's another kind of similar, and I'm not sure if this is for you or for Marlisa, but they asked, we started a prevention program in August, but the funds have not been released yet. Should my start date still be in August?
Yes. I don't know where Marlisa is, but yes. You, if you started expending funds, even if you weren't allowed to draw them, your start date should still be in this initial period. As long as you had a contract signed, you were allowed to go. So, yes, you can have that start date anytime then in this period that you started actually serving clients. And actually, you need to. You can't back in dates for, once you get to the next quarter, we're not going to let you set a start date that's in the initial period. So you're not going to be able to start a project back. You have to get all your projects in when you've actually funded that project.
Thank you. So I think those were my date questions. There was a question, did Michelle say after the initial upload on 10/30/20 that every project will be done cumulatively and quarterly after that? Yes, that is what she said. Follow up. If I have a few RRH projects, will each project be done separately or can I bundle them into one group? So I thought it might be helpful to say again the bundles, what bundles are.
Okay, so a bundle is one component, one HMIS system, one date range. So if you had 4 RRH projects that all started in this initial period, they're all going to get the same report start date, right? Because you set that, and that's what it's going to look like. You're going to, I keep going to the wrong form. I don't talk and drive well. You're going to enter those. and SAGE is going to put all of those in one project. So as this example shows, these 3 projects that all started at the same time, All for One Home, Good Life Inc., Tri-County Shelter, they're all rapid rehousing projects that organization runs. All 3 of those are going to be in the same bundle. So the HMIS lead will generate one bundle for the recipients and put those all together.
Thank you. So I just saw a question come in and then it moved on me, but let me, so there's a question that comes in that says, what if we don't serve clients until October or November? Can the start date be after October 1st?
Yes.
But not for this report, right?
The reporting start date is the date that you're going to report when you started serving clients. So back here, remember, if you said, no, you haven't executed a grant agreement or you haven't made any expenditures that serve clients, it's not even going to open those forms for you, right? So if maybe you got a grant agreement and maybe you made expenditures just for HMIS and admin, you're going to save the form. And that start date thing is not even there for you to complete. You don't even get to worry about it until you actually have started serving clients, because this is a reporting start date for the clients. It's not a reporting start date for SAGE. It's the report start date for your CSV reporting.
Sticking with that date theme. So we've got another question. We have a start date entered before the end of the quarter because they had emergency shelters that started in the initial period, but they're going to have rapid rehousing projects that won't start until November 1st. How do they choose the start date? Do you want to talk more about that?
Yep. So if you had projects that started in the initial period, then you have to pick a start date that aligns with when the majority of clients were served in that initial period. So think about this. If you funded a mass shelter where there's 200 beds a night, and then you funded a little family shelter where there's only 25 beds, you want to make sure that you're starting the start date with that mass shelter so that you don't overcount the mass shelter people. If you are really confused about your reporting start date and how to identify it or how to select it, we're happy to help you. If you put in an AAQ, we'll take a look at it with you and walk it through. When you put in an AAQ, you need to select SAGE. In the second step, it'll come to the SAGE desk, and one of us on this call will help you figure out what the report start date is for your reporting period if you're really confused.
And yeah, just to add on to that too, you can have, and I think we talked about this in the last session, the late starters, early enders. So make sure you check out the recording when it's posted on the HUD Exchange for more information about that too.
And it's also defined in the guidance. When you get this guidance, it will have a real clear, I hope it's clear for you, understanding of late starters and early enders.
So there have been some, oh, sorry, go ahead, Michelle.
I'm just seeing a confusion about recipient versus implementation. Yes. What is that? What's the question?
There are a few questions here. So, sorry, I'm trying to find them. A bunch came in when I started talking. in a multi-COC implementation. Okay, in a multi-COC implementation, is the HMIS lead pulling the data across all of the COCs? There have been several variations on that theme of question. So if you want to talk more about that.
Okay, so a COC does not get ESG funding. Let's just start with that. We're not funding the COC. We're funding the ESG recipient, which is the city, state, county, territory. So if you are a city that has a multi-COC implementation, you're going to send the request to that lead for that multi-COC implementation and ask them for the data for the projects that you funded that are in their implementation. If you are a city or county that is not big, the odds, even if you are big, the odds of you having just one HMIS are really, really strong. So for most cities and most counties, this business of multi-COC or who do I send it to or what do I do, it's going to be very clear who you send it to when you talk to your COC or HMIS folks. They're going to know. It's in the bigger communities that this becomes a problem. And it's definitely a humongous problem for the states.
Okay, so we had another question come in a couple times regarding the preponderance of clients. So if a smaller number of clients are served, let's say in July, then will be when most ESG-CV contracts begin in January of 2021. Should the start date be pushed to when the majority of clients are served?
Can you say that again? Are we asking for a contract start date?
No, I think what they're saying is they had a project start in July and it was a small project, but they know they're going to have big projects start in January. And so you were talking about when did most clients start? I think they're confused now and thinking that they should set their start date to be in January instead of July.
No. When did the preponderance of clients that you expended funds on during the initial period from January 1st to October 1st to September 30th, when did you serve the preponderance of clients in that period? That starts your report start date, because you want to get the CSVs in on those, even if it's a couple projects that you funded in the initial period. Maybe you funded a temporary shelter. Maybe you were paying hotel money so that people could move out of the regular shelters and social distance better. Those kind of things. If that's what you funded, then we want to be able to capture those, capture the number of people served. This is a huge federal program. It's $4 billion worth of funds, and HUD, the SNAP's office at HUD has repeatedly now been asked for how many people have you served. So they have to know if you've served people in that first period, they have to start seeing the CSVs for those.
Okay. I've got another one here about expenditures. So subrecipients will be making expenditures, which we will eventually reimburse, but we don't know the dollar amounts of these costs. We submit expenditures, can we submit expenditures in the next quarter because they reimburse on a quarterly period?
Marlisa, are you here?
I am here, yes. I would say, it makes sense that if you are, if you, I'm trying to make sure that I'm getting the scenario correct. What I would say is that if you are aware, or you should be in contact with your subs to be aware of the funds that they've expended, the costs that they've incurred during the quarter corresponding to the reporting period. So So if you don't usually get billed until like a month later, it's important to be in touch with your subs and to ask them, you know, we've got our quarterly report coming up here. Can you please give us your expenditures for this quarter?
So if the quarter ends on September 30th, you have until October 30th to submit the report. If you're having your subrecipients send you bills quarterly, you would have those expenditures by the end of the month when you have to actually file this report.
True. So that may, in the scenario presented, that may actually, the timing may work out in your favor with with reports due 30 days after. Right.
And expenditures means the funds that were expended on the clients for that during that reporting period. So it doesn't mean that you've reimbursed those clients, those subrecipients necessarily yet, and it also doesn't mean that you've drawn the money necessarily yet. It's the funds that your subrecipients are billing you saying they spent.
Okay. We have another question that I'm going to try to answer. We've had this conversation internally before. We say the same thing over and over, and sometimes have to tweak the way we say it because it's still not getting through. So there's another question about implementation. If there's one HMIS that covers cities, counties, and the state, is the HMIS lead only submitting one bundle for all the rapid rehousing projects served during the reporting period? So let me say this a different way. So you have one HMIS, city, county, and state. The city ESG recipient is going to contact the HMIS lead and say, I need those bundles for all of the projects that I funded in the city. The county is going to contact the HMIS lead and say, I need the bundles for all of the projects that I funded in the county. The state then is going to contact the HMIS lead and say, across the whole state, I need the bundles for all the projects we funded. When the HMIS lead then is generating those reports, Sage is going to tell them which projects and the date ranges, like Michelle showed in those bundles, they should be generating those CSVs on. So the HMIS lead is providing the recipient with the data about the projects that recipient funded. Tanya, I hope that helps. Okay. I also want to say that we have an HMIS lead call. We have an HMIS lead call. If any of you are HMIS leads, please make sure you're coming to that call. Our next one is on September 16th. We'll be taking HMIS questions then from HMIS leads, from system administrators. So please make sure you're coming to that call to ask these questions also if you're an HMIS lead. Let's see. Okay, so another question here. We funded a victim service provider that has submitted a draw for reimbursement and have clients they've served. So I will need to contact them to identify which comparable system they use. Will they be able to report that information into Sage? So far, they are the only agency that has submitted a draw, but once others begin providing services, but all agencies have begun providing services. Would the contract began 4/4/20? Would this be our start date?
If that's the only project that has started during your initial period, then that would be your start date. If you have multiple projects that started during your initial period, you want to pick the project with where a shelter or a street outreach program has served the preponderance of clients.
Someone asked for a link to the HUD Exchange for the ESG-CV portal. There is not a link on the HUD Exchange. You can go to sagehmis.info. That is where ESG recipients log in for accessing SAGE.
But if you are an HMIS lead asking that question, you're going to get a specific link to a specific portal. There is not a portal for you on the HMIS HUD Exchange or on the HUD Exchange or anywhere else. You have to wait to get your email for that link.
I think, Rob, correct me if I'm wrong, or Marlisa, but I think we've got the questions we can answered from the chat.
Did I miss the retroactive cost reimbursement question?
I don't see that question. So
I have one that says if you don't have an executed agreement but are providing services, what do you do?
Yes. So if you have already started serving clients, and this is sort of similar to the retroactive cost reimbursement question, within the broader context, the first case of coronavirus was back in January, so January 21st. We haven't established the exact date or the exact window where you could start reimbursing yourself for eligible costs. But let's say in general it's around the time of the first case of coronavirus. And you started doing an eligible ESG activity way back in January. You would not have had an ESG grant agreement in place yet, and you would not be reimbursing yourself for ESG-CV costs. So the way you handle it is first you need your grant agreement in place. So that means that you've already had your action plan substantial amendment reviewed and not disapproved by the field office, and that's your plan in place for your ESG eligible activities. Then you're going to grant agreement. Your grant agreement is signed. And then at that point, you can go back and, reimburse yourself for eligible costs going back to when your community started coronavirus response. And then that would also, the grant agreement is also triggering the time when you would start reporting. So you're not required to report until that grant agreement is signed. And that sort of just puts everything in place. We know that the field office is aware of the activities that you're planning on carrying out or reimbursing yourself for, and you've fulfilled all of you're not really applying, but the application, in air quotes, part of the process, and you've got your funds secured, and that is the reason why the grant agreement is really the trigger for the reporting requirements kicking in.
Okay. Will the information submitted by the sub-recipients for ESG-CV be the same type of information that is submitted for the regular ESG grant?
Yes, it's exactly the same. They're running the HMIS or Compro database is running an ESG CAPER report. It's the exact same report. So if they could do their regular reports, they can do this. HUD took pains to not change anything so that the HMIS burden was not any higher than it already is for this. So there's nothing that changed in those reports. It's the ESG CAPER report.
And to add to that, this follow-up question here, the recipient will send a link to the VSP to do the upload. The victim service provider does not need access to SAGE. They will go through the portal just like an HMIS lead will.
That's correct. They don't need a link. No subrecipient should be given a link or be given access to your entity in SAGE. You should not approve a subrecipient for access. They don't need it. Nor should you approve a victim service provider or HMIS lead to access. They do not need it.
Natalie Pacey, just to follow up there, your question is what if the VSP is the recipient and not a subrecipient? So I want to just direct you back to the earlier part of Michelle's presentation. I can't remember if it's her or Lisa that talked about who recipients are. Recipients are the units of government who receive the ESG-CV grant, the city, county, state, and territory. The subrecipients are the entities who receive the funding or are the providers from those recipients. Thank you for putting that back up there. Who is defined as the HMIS lead? The HMIS lead is designated by the continuum of care. So they may or may not be a subrecipient of your ESG funding, but that is a designation that's made at the COC level. And then Laura, I see your question, will we need to set up another ESG-CV category? I don't know what that means, so if you want to add a little more clarity to that, a little more information, we can try to answer that. Oh, you have an HMIS question. Okay. Yeah, bring that question to the HMIS lead meeting. Check out the ESG program manual for HMIS. There's more information. I didn't follow the answer on whether VSPs enter their CSV directly. The victim service providers will receive a link from the recipient where they will upload their report into SAGE. If we are funding the HMIS lead agency, how do they submit report in SAGE?
An HMIS, funding for an HMIS and funding for admin do not directly serve clients. There is no CSV report required. The only thing that's required for you as the recipient to do with HMIS is report the amount of funds that you spent on HMIS and the amount of funds you spent on admin. There is no CSV report required. They will never be asked for a report. Victim service providers, if you're an existing victim service provider and you are used to getting a link from your ESG recipient, you will get a link just like you're used to getting. It's just going to go to a portal instead of that page. It'll look a little different, but it's exactly the same thing that you've been doing. It looks the same. You're going to upload your CSV just like you did before.
So we've got another, what if we began spending money but don't yet have a grant agreement?
If you don't have a grant agreement, you don't report this quarter. Remember, we're back to those original questions. Have you executed a grant agreement? If you say no, all you're going to do is save the form and exit. You will not report on anybody or anything this quarter.
What if we only fund one organization with our CV funds? Do we still have to go through this whole bundle process?
Yes. That bundle is not by organization, it's by component. So unless you're spending all of your money on one shelter, yes, you have to do this. And even then, it's not designed for a subrecipient to do it. It's designed for the HMIS lead to do it. It's an awful lot of money. In general, HUD is expecting multiple kinds of projects being funded, either multiple of the same type or multiple of different component types.
This person is asking if we should wait to set all of this up until after September 30th, or can we set it up now?
You can set it up as soon as HUD lets us turn on Sage, which at this point is set for this Sunday. You don't want to probably send the bundles out until the end of the month when you're sure you've got everything right, but you can, it'll be on and ready for you as soon as HUD opens the door for it. It was supposed to be on last week, and we're still hoping that a notice is out to you before we turn it on. But it's scheduled to go this Sunday, whether or not there's a notice out.
I'm not sure the context of this or what this question means, but would we be able to later report if the start date is in this quarter?
Not if you have an executed grant agreement. If you have not executed your grant agreement and you're going to begin to report in the first quarter of the year, you're going to do that first report in December. At the end of December, you'll start it. We're going to let you go back and set a report start date that reflects when your actual expenditures were. And at that point, because it's a longer period, you're going to enter each project start date, and Sage will put them all in bundles from that.
If a contract is not executed and billable services begin prior, I'm sorry, I started reading that. I'm not sure. If a contract is not executed and billable services begin prior and contractor is selected, what is the protocol? We were awarded, but waiting on HUD for the executed contract. Are we still able to begin programs?
Marlisa.
Marlisa, that's in the Q&A pod there if you need to read it.
Thank you. Yeah, I am going to read it again. So it's perfectly legitimate, and I think a case for many people that they're going to have costs incurred dating back many, many months, even prior to the CARES Act awards being announced or the CARES Act even being published. So that's completely acceptable, but there are a few things that need to happen before we want you to report and before you can reimburse funds, one of which is your substantial amendment submission or incorporating the ESG-C funds in your annual action plan. So while you have been awarded funds, like the HUD posts the award amounts that are being awarded to cities, states, counties, and territories, but until you apply through your consolidated planning submission, you're not really authorized to start reimbursing. So accessing funds, in order to access your funds, you need to submit your substantial amendment or your action plan. Then that's sort of like, and again, this is sort of in quotes, but that's when the field office is approving your use of the funds. And then you also need to have your grant agreement with HUD in place. And then at that point, that's when we grant you access to the funds, you can go into IDIS, set up your activities, fund your activities, and then you can reimburse all the way back to when your community started responding to coronavirus, whether that's in March or January or February. But the ESG notice will give you the window for how far you can go back to reimburse, and then it will also provide information about how you can document the connection to coronavirus response to make sure that you have everything in place to be able to reimburse for the funds that you incurred, to make sure that it's an eligible activity, that you've got the documentation, that you've got your environmental review requirements completed. So there are a number of things that you need to do before you're incurring costs. And but in order, like the connection to reporting here is we want to make sure that the field office has seen your plans for the funding and that part of the process is completed, and that that you've actually been obligated the funds through the grant agreement with HUD. So although you may have been awarded the funds through an award announcement, the consolidated planning submission part is critical, as well as HUD actually obligating the funds to you via grant agreement amendment.
Okay, we've got a question about validations for SAGE, I guess. Should we anticipate the same CAPER data quality expectations with regards to the uploads due in October?
So SAGE does not validate for data quality. We ask the recipients, the ESG recipients themselves, to work on data quality on an ongoing basis with their subrecipients. So those are not validated in the regular ESG and will not be validated in the new ESG. What we do validate is again, like I said, to question 5, if you served 1,000 people, we're going to look for basic demographics on 1,000 people. If of those 1,000 people, 500 exited, we're going to look for 500 exits. All of those projects need to be correct. If you're a victim service provider providing domestic violence shelter, we're going to look to see if all of the people in your project are DV people, have been marked that way in the database. Somebody fleeing domestic violence.
I don't see any unanswered questions at this point. But as soon as I scroll up, they come in. So is the start date the day the contract was signed or the date the agency sends an invoice for reimbursement? A contract was signed in early August, but we have yet to receive an invoice for their funds.
It is the date they started serving the client. So if you contracted for them to start on August 1st, you need to check that they started on August 1st, and that would be your start date.
Is it allowable to purchase COVID-related supplies for outreach without having ESG demographic info?
Marlisa?
So I'm going to unpack this a little bit. If you have COVID-related supplies such as PPE, or hygiene kits that you'd like to pay for with ESG funding, that is an allowable street outreach cost. When you are using ESG funds to provide street outreach assistance, ESG reporting is required. So, that means that all required program-specific data elements and universal data elements are required, but we do understand that when street outreach providers are doing street outreach, it's not always easy with the first contact to be able to collect all ESG demographic info, and I think that we all understand that, but the ultimate intent of street outreach is to engage program participants and to have continuous encounters and to basically perform housing-focused street outreach. So to the extent that you're meeting program participants multiple times, HUD would expect that that providers are doing their best to continue to collect relevant demographic info on a continual basis. Bottom line is we understand you're not going to be able to do a complete and thorough assessment, seeing a client the first time in a non-community-based setting, in an unsheltered setting, but that providers should be making every attempt to collect demographic info, especially when they're seeing clients multiple times.
So if I could just add to that, Marlisa, a little bit.
Yeah.
If you have a street outreach program that just had your street outreach worker stand at a camp and pass out masks for everybody and maybe flyers on how to social distance, that I could see that happening, and that was your total, the total extent of what you did with street outreach, then if you put an AAQ in and describe that, how to make a determination on what we do with an upload at that point. Because I totally get that there are activities that you could have done during that time that there is going to be no HMIS data for. Handing out masks at a camp would definitely be one of those. So I think it really depends on the situation, and I think HUD will look at that on a case-by-case basis then, and we'll figure out how you do reporting. Would that be correct, Marlisa?
Yes, and I think you bring up a really good point, Michelle, that, when you're doing COVID response, I think that there are eligible activities. This is sort of going to pre-award costs and reimbursing, going back to the start of the window, which will be established in the notice. We also understand that your community may have been responding to COVID without having any idea that CARES Act funding would be available, and so you're not thinking about HMIS reporting or coordinated entry or a host of other ESG requirements. So, we will be providing information about how you can sort of balance the two. HUD is keeping in mind that there are eligible costs that may not meet every single ESG requirement. So there are definitely plans in place to accommodate that. But again, please hold out for the notice for more information on that.
On that same topic, Marlisa, there's another eligible expense question. Would PPE be considered admin costs?
No, you can bill PPE, personal protective equipment costs, directly to the eligible activity as an overhead cost. So if you're outfitting shelter providers with PPE, you can charge it directly to shelter operations, or if you're providing it to shelter staff, shelter residents, that would be shelter operations, or if you're going out and providing it to people in unsheltered locations, then, under street outreach. Under rapid rehousing and prevention, you can pay for PPE, but only for staff, so it's not an eligible cost for program participants under rapid rehousing or homelessness prevention. But you would just charge it to, as overhead for rapid rehousing or prevention for staff PPE.
So for the question of can a street outreach person certify demographic information, the HMIS is going to ask those questions, and there's a whole procedure in all of the HMIS manuals that fund street outreach for how you collect that data and at what point you're required to collect it. So it's not until the point of engagement that HUD looks at data quality. The reality is that there's a good number of street outreach people without complete demographic information. They might have some, but they won't have all.
If I just lost the question. Okay, if we are funding an essential service, for example, transportation to COVID-19 testing sites, as a standalone activity that is not tied to one particular shelter, do we need to report on it its own in SAGE or under emergency shelter?
I'm sorry, I didn't understand the question.
They're funding, let's say, an essential service, transportation to COVID-19 testing sites. It's not necessarily tied to a particular emergency shelter. Do they report? How do they report on that in SAGE?
They have the reporting and the draw formula scheduled so that it's got to come under a component. So if you're transporting people, it's either under this, and they're, just from anywhere and everywhere, it would either be under a street outreach component, or if they're coming, mostly you're transporting folks from shelter, it would be from in the shelter line item then.
Go ahead, Michelle.
Meredith, will you put the link in that they have to register for the HMIS leads?
I did.
For them.
And okay. I will do it again. Yep.
Okay. So the HMIS lead call is a regular ongoing call. It's a monthly call that all the HMIS sysadmins or leads have. If you are an HMIS lead, you should be regularly attending that call and should be already on the list. So it's the same call, the same session that you'd normally attend. We're not doing a special session.
So I think that is all the questions, and it is 4:29. I think did you have a couple more slides to get through there, Michelle, at the end? Or did you cover that?
We've given you a couple of links, just the links for where ESG-CV is, where to access the tapes again is here, or the recordings. General COVID things. And then the last slide is to remind you about office hours. These office hours are not presentations. They're traditional office hours where we will be available to answer questions. We will answer kind of generic questions during that time, but we'll also, depending on time and the population of the call, be able to answer some specific questions too. If you have specific questions that you don't think are appropriate for a call, you can put those into the AAQ. But otherwise, the office hours are meant to answer questions from recipients, not from HMIS leads, not from subrecipients, to answer questions from recipients on their reporting issues. And we hope that if you're a recipient, you'll join us for those if you have questions. And we certainly hope, on behalf of HUD and PCL and all of the people that have worked on this reporting, that though we know it's a lot of work, that we've made it as painless as possible for you, and know that we're here to help you if you get stuck. That's it. Thank you very much for attending. We'll talk to you all in the months to come, I'm sure. Take care.
Thanks, everybody. Bye.